Good afternoon. My name is Brandy Jensen. I'm the Director of Programs and Services with the Brain Injury Alliance of Iowa. And today I've got with me Dr. Kristin Caraher.
Hi, thanks for having me. Yep, my name is Kristin Caraher. I am a board certified neuropsychologist at the University of Iowa Hospitals and Clinics. I primarily do neuropsychological assessment there, but I also run a cognitive rehabilitation group and take care of our residency program as well.
Awesome. Thank you so much for joining us today.
Of course.
We would love to get some conversation going around neuropsych evaluations in general. So can you take some time just to tell us a little bit about what a neuropsych evaluation is and who gets them?
Yes, absolutely. So I feel like this is a question we get a lot, even when our patients come in, they're kind of like, oh, I'm here for a neurology appointment, or, oh, I'm here to see psychiatry. So it's kind of like, what do we do? So neuropsychology is kind of a specialty field, and we're kind of a combination of all these things, right? Neurology, psychiatry, psychology, but essentially we're psychologists at the end of the day, but we specialize in the cognitive abilities or the brain functions, the thinking skills. These are things like your attention, memory, speed of thinking, some intellectual functions, things like that. So we really look at, we do of course look at mood and personality, motor functions, but primarily we're focusing on the thinking abilities and how those skills are functioning. So who gets these evaluations? Really, it depends. Lots of different folks, people who tend to complain or are experiencing cognitive problems in their everyday life. These can be people who have dementia, people who might have Alzheimer's disease, vascular type of disease, who might have questions about a diagnosis of dementia or mild cognitive impairment, people who have experienced a brain injury, traumatic brain injury, stroke, maybe a transient ischemic attack, epilepsy, degenerative other types of conditions that might affect movement, like Parkinson's disease, Huntington's disease, multiple sclerosis, folks who might have systemic cancer with metastases or a brain tumor itself, infections. Also, we see a lot of folks with medical comorbidities, so people who have disease kind of that affects different aspects of the body, like lung, liver, kidney disease, autoimmune conditions. So really a wide variety of individuals with different presenting complaints can come for a neuropsychological evaluation. We also see people who have co-occurring mood difficulties. So that can be depression, anxiety. We see people who can have complex psychiatric conditions like schizophrenia, bipolar disorder, personality dysfunction. So you name it, we probably see it in neuropsychology. Some things that people will come in and ask about is kind of how long will something like this take, or what types of mental functions are assessed in our exam. And typically, like I mentioned, we're going to be looking at things like your attention, speed of thinking, intellectual abilities, reading, comprehension, motor skills, visual, spatial, or perceptual abilities. And all of these things would be described in much more detail and we would ask questions about these different skills when we meet with folks. So lots of different things like that. In terms of the length of the appointment, it's not your typical doctor's appointment. This is what I always tell people when I see them. You're not in and out of there in 30 to 45 minutes. The evaluation typically starts with an interview portion. We review medical records before we see a patient. Then the interview portion can take that 30 to 60 minutes itself, where we really gather history information from the patient and a collateral. So somebody who knows that person well, if they accompany that person to the appointment, or if they give us permission to call that person. And then after that, we'll have the patient meet with a technician or a trained psychometrist, really a person who knows how to give these tests and who is well trained. So that's the portion that can take quite a bit of time. That can take a couple of hours. And really that's where we're actually measuring these cognitive skills. Specific instructions are given before each task. And we answer any questions that the person might have. So not to be scared that you have these, couple of hours of testing that somebody's telling you what to do before you do each thing. And then after that, especially because of the way that things are right now with COVID, we have people just leave the hospital after that. We give them a call in a couple days after we score everything up, interpret their results, and then we give them feedback over the phone. We used to do feedback in person, but typically we're doing that remotely at this point. Oh, I think you might be muted
Oh,
actually.
oops. Thank you.
Sure.
Gotta love Zoom.
Yep.
Thank you for all of that detailed description. Obviously, this is a field that you're an expert in, and it's a specialized field. Are there other providers out there that do these types of evaluations? And can you provide some insight around that?
Yeah, so typically there are, so really neuropsychologists should be the ones performing neuropsychological assessment. There are other psychologists that certainly can perform other psychological assessment, and that if they have training in some neuropsychological measures, that's something that they can do within the scope of their license. There are lots of neuropsychologists out there. There's actually a directory through the American Academy of Clinical Neuropsychology that has a list of other board certified clinical neuropsychologists. And this is a national resource. So this is a website. It's actually just the aacn.org /directory and then another slash, but I can provide that website to you as well. And this is a great resource that you can find other neuropsychologists in your geographic location who have those credentials that you'd be able to see. One kind of barrier is that Iowa has a more limited amount of neuropsychologists, but we do have pockets of folks in different cities here in Iowa. There are some speech pathologists that do some neuropsychological assessment on rehab units, and they may do some of our screener measures or some kind of smaller aspects of testing. But to do a full neuropsychological evaluation, we would really recommend that you do meet with a neuropsychologist who's had that specialized training.
Great. That's really helpful to get those details on how to locate them as well.
Yep.
Is this something that is going to be covered by people's private insurance or by state funding like Medicaid?
Yes, that's a great question.
Or
So
Medicare? Mhm.
yeah, so insurance coverage varies pretty widely. So I think, at the end of the day, it always is best to check with your insurance company. If you are having concerns about cognition, and I can kind of go through what some of those specific cognitive concerns might be, some of the typical ones that we see. But if you're having those problems, or if somebody's noticing someone is having those difficulties, it's always great to check with your insurance company. Medicaid does cover neuropsychological evaluations, at least a portion of it. Same with Medicare. Medicare typically covers one per calendar year for individuals. Medicaid, it's a little tougher to get those fully covered, but depending on the referral question, the potential diagnoses that may be used, they sometimes will cover the full amount. So most hospitals and clinics will have a pre-approval process for certain insurance companies, and we're intimately involved with those pre-approvals. So we do see that Medicaid is one that it's a little tougher to get the full coverage, but typically some portion of the assessment is usually covered. And there are specific CPT codes. These are codes, these are like procedural codes that we use when we do our billing. And someone could always ask their insurance company to, do you cover these specific codes for neuropsychological assessment when they're calling to inquire, or if a family member or social worker, someone might be helping them, they could always ask those questions.
That's very helpful. Do you find that it's getting them covered is reliant on the diagnosis codes as well as the procedure codes?
Yep, the diagnostic codes and the referral question seems to play a pretty big role, especially with Medicaid. Some of the private insurance companies, it doesn't seem to be as big of an issue. They kind of will cover, I don't want to say any type of condition, but there doesn't seem to be as many limitations. Medicaid has probably the most limitations, and they tend to deny coverage, or I guess maybe not deny. They might have issues with covering fully if there's other co-occurring problems going on, like significant substance use or things like that they think may be playing a primary role in the cognitive difficulties versus an injury or a stroke or something like that. But we have these different kind of consultations called peer-to-peer, where we can talk with a psychologist at Medicaid or with an insurance company, so we can actually advocate for the patient to try to get them more coverage and additional hours of coverage. So that's something that my colleagues and I are very familiar with. We're doing those often for folks.
That's great to hear that you're advocating for that to get covered in those instances like that, because we know that individuals with brain injury, experiencing those multi-occurring conditions, it's so very common. And so I think that that is a barrier. Are there any other barriers that, come to mind for you in thinking about the brain injury population, that, what barriers they experience in accessing this type of evaluation that they could benefit from?
Yeah, definitely. So I think some of the barriers I think about in terms of neuropsychological care also mirror the general barriers to access to healthcare, including just the cost, limited financial resources that many individuals have, inadequate insurance coverage or no coverage at all, lack of availability to services, especially in Iowa. Like I mentioned, we just don't have a bunch of neuropsychologists. In other markets. It's very saturated with neuropsychologists. So in Iowa, it's a little bit more limited, but the ones we do have are really great. And I could always provide you specific hospitals outside of the University of Iowa that we have, that we know of good neuropsychologists. I think transportation and geographic barriers are also an issue, which I think is getting a little bit better with telehealth. We've been able to do some telehealth since COVID started, and I think telehealth really is here to stay. I would say that there's not a lot of silver linings that have come out of this awful pandemic, but I will say that telehealth seems to be. I mean, there was a patient I saw recently, really significant disabilities that she has, and it would have been terrible to have her come in. She really wouldn't have been able to participate in formal testing. So we were able to do the entire evaluation remotely, and she was hours away. So this is just something we probably wouldn't have been able to do before the pandemic has occurred. So I think another additional barrier too is just kind of health literacy, folks kind of knowing what their conditions are, what they may have access to, what a neuropsychological evaluation is, and some providers not even knowing what our services are. So that may limit referrals and not really help identify who is in the greatest need of these services.
Absolutely. That's really helpful. In thinking about, the access to the services for individuals, where, Medicaid, for example, or individuals who don't even have access to full Medicaid, perhaps Iowa Health and Wellness, which is, a different version of that here in Iowa. What efforts do you think would be necessary to try to get more paid for these types of evaluations for individuals so they could see benefits? And what kinds of trends across the country have you seen other states maybe have success with or have tried to try to get an increase in these paid for?
Yeah, that's a great question. And unfortunately, one that we don't have the best response for yet. But what I think is a good start is, interviews like this, getting information out about what these assessments are, the utility, the value of these assessments, and how they can identify strengths and weaknesses, somebody's baseline abilities. They can help identify treatment planning if somebody's had an injury. So lots of value for assessments like these. And I think I think increased outreach and communication with providers and just the public about what these services are and how much people can potentially benefit from this. That's one step. There's some national organizations, including APA, which is our American Psychological Association. They've advocated for neuropsychology to kind of educate insurance companies about the utility of our assessment and to help individuals understand, what we do, potential coverage to get better reimbursements, which will hopefully improve utilization and access ultimately. I know one thing that we have at the University of Iowa is we have a team who specializes in financial counseling for individuals. So let's say you do have Medicaid, or maybe you don't have insurance, they can talk with you about your different options to pay for this type of service. And if there's, if there's other support that they might be able to provide for that particular person. We also have social work and kind of support staff that are helpful and available to assist with navigating those barriers, as well as others like transportation, geographic limitations, things like that. But I think ultimately there may be legislation or kind of on a higher level that may need to occur to continue to advocate for marginalized populations who really need additional funding and additional support, because those are the folks that are getting missed and not getting the assessments that they really need. And it's quite tragic to see.
It definitely is. And you think about the cost, for an evaluation like this may seem like a lot, for the funding, the funders, or even, the different individuals and legislators that are looking at these costs. But when you look at the outcomes that can come out of an evaluation like this to help
Yeah,
drive the service planning for an individual to have better outcomes,
right,
you would certainly think it would be a cost savings in the end. And
right.
so, we certainly feel like advocating for this to be accessible to more individuals would definitely be a benefit. So it's great to have you to help the public understand the services and the value of it. So thank you so much. Is there anything
Absolutely.
else you would like to share with us today?
Uh,
Uh,
let's see here. I think just a couple things. One other thing I wanted to talk about was just what are some of the common complaints that somebody might have that might signal, hey, maybe I should talk to my provider about these difficulties, and maybe this is outside the norm. Maybe I could use an evaluation. I think sometimes providers are not sure too. Is this just normal aging? Is this a common change after an injury? What's normal? What's not? And that's really where neuropsychology can be the gold standard. We compare people to a normative sample. So we compare people based on their education and their age. So we can say for most people who are medically healthy, who are also 25 or 85, this is where skills should be falling. And if yours aren't falling in that range, what can we do about it? How can we help you live the most optimal quality of life moving forward? So these are the type of things that people maybe might notice in their everyday life. They might notice changes in their short-term memory or recent memory, maybe asking the same question repeatedly. Family members, providers, staff who might be working with these folks might notice this as well. Maybe you're losing things often. Maybe you're getting lost all the time. Maybe you're bumping into things. Maybe you are having trouble driving or trouble with other activities of daily living, like managing your finances. Things that weren't hard for you in the past have become more difficult or challenging for you. Maybe there's more confusion and you're just feeling a little bit more lost. And that all of these cognitive things I should also mention can really impact emotions, right? Our brain doesn't discriminate. So we've got neurotransmitters up there that are responsible for our emotions, but also they're responsible for cognition. So if we're having these changes, we might get a little frustrated and have some emotional changes as well, and really vice versa. So there might be some difficulties with judgment or decision making. People can become more impulsive, and that can be really impactful for quality of life and for people around them as well. So, and if you're having difficulty just understanding what people are saying what you want to say, expressing yourself, or if you're having people look at you like, that can be embarrassing, that can be frustrating. So really talking to your loved ones about this or your providers and saying, maybe we should get these skills looked at to see if this is just a normal change, if this is expected after an event I went through, an injury I went through, or if it's not. And at the end of the day, what can I do about it? How can we really help? And that's really where I feel like neuropsychology can be super helpful is providing tailored and unique recommendations for each individual that are also realistic. If we tell you to do A through E, but you don't have any resources to even get to the appointment, how realistic is that? So we really take that into consideration when we're developing these recommendations in the neuropsychological report.
That's very helpful. I guess one last question I have for you is, why do you think that there is um, really not a huge population of neuropsychologists in Iowa?
It's a great question. I remember when I was coming here for this position. So I was at a different place in the country. I had originally trained in Chicago. I was in Arizona at the time, and we wanted to come back to the Midwest because we were starting our family, yada yada yada. And there weren't a lot of jobs open in some of these bigger cities, but there were jobs open in the surrounding areas. And when I applied for this job, I was like, oh, it's a great university. Seems like a great place to live. Yeah, I don't know a ton about Iowa. And I remember when I talked with folks when I interviewed here, they said it's a little tough to recruit here. It's hard to find people who want to live in Iowa. It's kind of almost like a national, nice kept secret. Like, it's easy to live here. The people are nice. We have nice seasons. And I was like, well, I was born and raised in the Midwest. It can't be that different, you know? So we took a gamble and now we love it. I mean, we can't imagine being anywhere else and raising our kids anywhere else. But I do wonder about that, though, is that people don't know a lot about Iowa. It is a little bit, it's just doesn't maybe have as many popular destinations. So I think sometimes it's harder to recruit to get people to come to move their entire families to live here. But I have told a couple of colleagues, let's keep it that way. Let's keep the traffic down. Let's keep you all out of here, you know, if you don't want to be here. So it's kind of been this joke that we tell each other,
Yeah.
you know, so yeah, that's what I think that might contribute to it.
Yeah, definitely. Well, thank you so much. And we really appreciate everything that you've been able to share with us today. So thanks for joining us today, and have a great weekend.
Thank you so much for having me. I appreciate it. And let me know if I could ever be of help in the future.
Absolutely.
All right. Thanks. Take care.
Bye-bye.
Bye.